Hi, this is Dr. Dan. I'm here to tell you about my brushing technique called the brush, floss, rinse, brush technique. In the past, when I was using toothpaste, I noticed that when I finished brushing my teeth, there would be a little film on my teeth of glycerin and mint and flavoring from the toothpaste, and it made my mouth feel clean. So one day I rinsed out my mouth, and then I went back and I put 5 sips of water and I systematically brushed my teeth, and I found food and all kinds of other things in between my teeth that maybe have not been removed in a while. So I decided to start this technique. So the first thing I want you to do is I want you to take 5 sips of water, put a little tiny bit of toothpaste on the brush, and then I want you to place your mouth. I want you to brush your teeth your normal way. I want you to ensure me that you brush it that way because we're not going to do anything more or less. And the reason we're going to do that, because in the second brushing, you'll find out how your brushing went in the first time. You'll find food and things like that. Also, the next thing you want you to do is floss your teeth. And then once you finish flossing your teeth, I want you to rinse everything out. Once you've rinsed everything out, then we're going to start the second brushing technique. I want you to take 5 sips of water. I want you to angle the bristles so that the bristles are going to be into the gum at about 45 degrees. And I just want you to move it like this. Very, very gentle. We're going to do 1.5 minutes per quadrant. Once you finish a minute and a half, then do the second quadrant, angling up. On the bottom, you'll be angling down towards the gum and you'll be doing that stroke. Once you finish doing that, I want you to take 5 sips of water, and we're going to do our second stroke in the second brushing technique, and that is to place the bristles kind of perpendicular to the gum, place them in between the teeth, and I want you to roll the toothbrush down to clean in between the teeth. This is going to augment, along with the first brushing technique, of getting into the tissue and in between the teeth and stimulating it so it becomes much more firm, and also it'll help get most or the rest of the plaque and bacteria out as best we can. Once we finish doing that, then we're going to take some water and then we're going to clean the tongue. I like using the back end of the toothbrush and the bristles. Then I'm going to take some water and we'll do the top of the mouth. We'll just clean the palate. We'll take some water and we'll clean between the cheek and the gum on the top and the bottom. And then once we're done with that, we'll clean with some water underneath the tongue. That'll pretty much encompass everything. If you have a water flosser, you can use that at this time. You can also use some mouthwash if that's what I want you to do. Or if you just like the clean taste of having it like that, or maybe putting a little toothpaste and putting it back on your teeth, that's all right with me. When you get up in the morning, it's very simple. You take 5 sips of water, and then I want you to brush in a generalized way. Since you haven't eaten yet, I want you to do this right after you get up. So brush in a generalized way. Then I want you to floss. I want you to take 5 sips of water again. I want you to brush in a generalized way. If there are areas in your mouth that may have some inflammation, you can spend some more time there. Once you finish that, we brush the tongue, brush the palate, brush the vestibule, and then we brush underneath the tongue. That'll pretty much do it. Within about 4 days, we go from 1.5 minutes per quadrant on the top and the bottom with the second brushing, and then we're going to move to 30 seconds. After about 2 weeks, I want you to go to about 20 seconds. By that time, you're going to notice a tremendous change. The other thing that I found, that after about 4 days of brushing 1.5 minutes, it may be a little sensitive on the first couple of days, the gums, but that'll definitely go away. And then the funny thing is, when I did this the first time, I woke up in the morning on the 4th day of doing this technique. I woke up and my mouth was clean. So I'm wishing you all well. I have great success with this, and I have a tremendous amount of success with my patients doing this. So all I can tell you is go for it.